Hi, I'm Dr. Beltre from Beltre Bariatrics, and today I'm going to talk about a topic that patients usually ask me regarding weight loss surgery or bariatric surgery for an adolescent or a teenager. If it is safe, if it's something that is doable, does it work? And what's the best age to have it done, so on, so on, and so forth. First of all, yes, adolescent and teenagers can definitely have obesity surgery or bariatric surgery, and they do very well, and they get excellent results. In fact, they are one of my favorite patients because the results are so quick and so noticeable. There are, however, topics to be considered, and before you have your adolescent or teenager or undergo bariatric surgery. First, they should be evaluated by a medical or professional team with experience in these types of patients and procedures. First topic to consider is the age and development. Normally the age should be anywhere between 13 to 15 years of age. Those are the ideal age to have obesity procedure as a teenager. Personally, my teenage patients, I start at the age of 14. I don't do 13 years. I wait until they're about 14 years of age. I know of even younger patients of the age of 12 that have gotten preteens that have gotten obesity surgery. I normally wait until they're about 14 years of age, and they have reached physical maturity. In other words, their body looks like they're going to look when they are full-grown adults. They have reached physical maturity or are near maturity. This makes sure that the body will handle the surgery and its potential side effects more effectively. However, like I said before, age alone is not a sole factor. There are other things to consider. Maturity level, especially psychological readiness, are also crucial, very important for this type of patient. It is very important for teenagers to understand the implication of the surgery and to be actively involved in the decision making prior to any weight loss procedure. So, physical readiness, mental readiness, all these things are very important. Health conditions. Bariatric surgery is usually recommended for teenagers who have severe obesity, meaning they have a BMI of 40 or above, meaning they are at least 100 pounds overweight, or have obesity-related health issues that are not improving with other treatment. Example of these diseases would be type 2 diabetes, high blood pressure, severe sleep apnea, high cholesterol, illnesses that normally have to do with severe obesity. So someone that have some of these obesity-related diseases that are not being actively treated or are being actively treated but not responding in a positive way can be candidates for surgery. Teenage patients that are considering obesity surgery should also undergo a thorough medical evaluation to assess the overall health and readiness for the procedure. What does this evaluation entail, this pre-op evaluation? Well, number one, psychological evaluation. Mental health, it's crucial, it's very important aspect of obesity surgery, like I said before, especially for teenagers. They should undergo a psychological assessment to ensure they understand the implications of the surgery, that they are emotionally prepared and have realistic expectation about the outcomes. And I cannot emphasize this enough. I mean, think about this for a minute. A lot of preteens or teenagers or adolescents have been overweight pretty much their entire lives, right? Some of them might be in high school or are about to go into high school, and they have been obese pretty much or overweight for most of their entire life. They have tried multiple medical weight loss programs that have not worked, and so on and so forth. Unfortunately, they have suffered through some of the social stigmata that is associated with being overweight. All of a sudden, this individual undergoes surgery, they lose the weight very quickly. The body changes very quickly. I mean, they look different, they feel different, their self-worth and self-esteem goes up. They are viewed differently by their peers. I mean, some males, some females are actually very good looking, and you don't know them until they lose all this weight, and all of a sudden they are treated differently by peers and so on. So they begin to get attention that they had not been used to most of their lives, and they have to be psychologically psychologically ready to deal with something like this. This is why the pre-op psych evaluation is very important. Not only pre-op or before the surgery, but also continue psych monitoring after the surgery, because the changes occurred very quickly and are ongoing. So this part of the preparation for the surgery is very, very important, just as important as undergoing the surgery itself. Well, what are the surgical options? There are 3 different types of procedures that we do. We have the gastric bypass, of course, the gastric sleeve, and the duodenal switch. The choice of procedure, of course, depends on the individual's health status, preferences, and the recommendation from the healthcare professionals. As far as surgery is concerned, I'm going to tell you what my personal preference is. I prefer to do gastric sleeve in all my teenagers and adolescents. I don't do anything other than a gastric sleeve for many reasons. Number one, the gastric sleeve is very safe. It is very well tolerated and works really, really well. But more importantly, or just as important, the gastric sleeve doesn't affect how someone absorbs nutrients and vitamins and so on. And some of these things are still growing. So I don't want to do a procedure where it might affect how they absorb proteins or vitamins and things like that. So I prefer the gastric sleeve. Also, very, very important, obviously they're very young. These are teenagers, these are adolescents that still have most of the time their lives to live, right? What's going to happen when they're 30 or 40 and they already have children? They might regain some of the weight back, right? I mean, that's very possible. Well, with the gastric sleeve, you still have options. The gastric sleeve can be converted to any other procedure, including a gastric bypass or a duodenal switch. So this is why I prefer to do a gastric sleeve for my young patients, because I feel I have not burned any bridges. They can, in the future, 20, 30 years from now, can still undergo another procedure to lose the weight if they regain the weight. How about for post-surgical care? Well, after surgery, like I said, teenagers require ongoing medical monitoring, the nutrition status, for example, and continued support from the healthcare providers to ensure that they adapt well to the changes in their digestive system. Not only the physical changes I just talked about, right? Remember that physically they change very quickly, but also the body is changing outside and inside. So changes in the digestive system also to help them maintain a healthy weight and manage any potential complications that may arise. This teenage patient or adolescent need to follow a healthy lifestyle, take their multivitamins as prescribed, and engage in regular physical activity to develop muscle mass, maintain their muscle mass, and support weight loss overall. As stated before, in addition to medical support, they need continued psychological support. Mental health is crucial aspect of obesity surgery for teens. As I said before, they experience emotional changes after weight loss, or emotional challenges related to the body image and lifestyle changes and social interactions. Like I said before, a lot of my patients that are adolescent or teenagers have been obese most of their lives. All of a sudden now they lose the weight. Their peers treat them differently. They have different social interactions now. They're more noticeable now to the opposite sex. So they're going to be having all these social pressures, if you will, that they need to learn how to handle it. And unlike an adult patient, an adolescent or teenage that had gone obesity surgery and have lost a lot of the weight needs to continue counseling and support through support groups or psychological counseling as they lose the weight and become more adapted to their new body, because their body completely changes. Well, in addition to losing the weight and looking great and feeling great, what else does obesity surgery do for teenagers? Well, it actually also addresses the health conditions that are associated with obesity surgery. With significant weight loss improvement in obesity-related health conditions like type 2 diabetes goes away sometimes within days of the surgery. It's pretty amazing. The metabolic changes that occurs as a result of a gastric sleeve, for example, within a week after surgery, the type 2 diabetes is gone. Sometimes also high blood pressure. So high blood pressure takes a little longer, maybe 2-3 weeks, but high blood pressure will be gone. Sleep apnea, all of a sudden, they don't need to sleep with a cumbersome CPAP machine because the sleep apnea is gone. So a lot of positive changes physically physically, psychologically, medically. The extent of these benefits, of course, varies from person to person, but generally speaking, I would say that over 90% of individuals that had the high blood pressure, type 2 diabetes, sleep apnea, all these stuff go away, and they are not only look healthier outside, but they healthier inside. How about long-term effect? What happens later? It is essential to understand that this is not quick fix and requires lifelong commitment to healthy eating habits, regular physical activity, and follow-up medical care. So it's not just undergoing the surgery and losing the weight initially. It is a lifelong commitment. So people have to be ready for the changes to come, and get used to the changes, not only physically, but emotionally and psychologically. To summarize, bariatric surgery for teens can be safe and beneficial when performed by experienced healthcare professionals with thorough pre-op assessment, appropriate patient selection, appropriate surgery selection, comprehensive post-op care. All this is crucial for parents and teenagers to weigh the risk and benefits carefully and make informed decisions when consulting with their healthcare team. I hope this video was helpful in helping you making a decision for your teenager or adolescent. Again, I'm Dr. Beltre from Beltre Bariatrics. I am a practicing bariatric surgeon in the area of Orlando, Florida.